In the fast pace of life, it's really useful to take some time off. Just refresh, recharge, re-energize, and to be able to hit the ground running the next day.
Time off is a precious thing for tech entrepreneur Zain Banner. In 2018, at 23 years old, Zain went into business with his longtime school friend, Mpumelelo Mhlongo.
Pumi and I were in high school together. We went to Kearsney College, and I met Pumi in the year 2009 when we were both in grade 9, and our friendship has been strong ever since. Pumi and I have a passion of making a difference in Africa, and one of the things we really were passionate about based on our own journeys and experiences in the healthcare sector was to look at how can we make an impact.
Together, the pair launched health startup Steady State Ventures. Zain says their digital platform Steady Care provides patients with an up-to-date healthcare record, including details of ongoing treatments, results, and a telemedicine service accessible from hospitals or home.
My grandfather passed away when my mom was at a very young age, and also from my experience spending some time in hospital when I was young, had gastric flu, and so the time spent during that time made me realize what it's like for a patient to experience the hospital and healthcare sector.
For his co-founder, friend, and Paralympic athlete Mpumelelo, the cause feels just as personal.
I owe my life to healthcare. And in all honesty, I was born with the amniotic band syndrome, spent the first 6 years of my life in and out of hospital through specialists. But I think the real turning point is twofold. The first is when I lost 2 of my family members who were waiting an award, not even a ward, on the aisle for assistance and never received that assistance, so they ended up dying. The second to that is that when I was younger, I had an asthma attack. And then we went to Guatabega Hospital, public hospital here in South Africa. When we got there was another old man that had also had an asthma attack, and the nurses had to choose who to assist. They chose the child, and while they were assisting me, the old man died. And that's just, that's not something that anyone should live with, and that's not something that should be happening in the 21st century. Yeah. Cool down and then...
The rare birth abnormality, amniotic band syndrome, left Mpumelelo with a club foot and a right leg shorter than his left. But that didn't stop him from breaking 2 world records at the Paralympics in Tokyo in 2021.
I have a passion, I have something that I care about, and I can manifest it in a way that other people appreciate. And I think that core feeling is what I take away from representing my country.
Not one to shy away from a challenge, even Mpumelelo was intimidated by taking on South Africa's healthcare sector.
Entering the health startup space in South Africa is extremely daunting. I mean, the facts are scary. First year, 80% fail. First 5 years, the 20% that made it, 80% of them fail. And, funding opportunities and really having a network that will back you, so a client base that already exists when relationships are formed over years and you're a 20-something-year-old that has no experience in the healthcare space is daunting.
A lack of experience didn't stop Mpumelelo and Zain, both trained engineers, from pursuing their passion.
With digital trends happening, patients need to take or want to take more control and have access to their treatment journeys. And at the same time, with the lack of doctors in terms of the number of doctors to patients, especially in the public and private space, doctors and patients need more access to their health information and records that can be easily accessible through digital devices and our platform. The telehealth app allows the doctors to be able to call in and communicate directly with the patient and family as well, and that allows a more personal interaction and allows for the doctors not to be necessarily at the bedside when treating the patient. The patient also has access to general information, which gives them indication in terms of their treatment plans as well as what their conditions might be, so they're better informed and more engaged in their better control of their treatment process. At the same time, there's vitals, which the patient has at the bedside, as well as again at the home care setting, and the doctors are able to access this remotely, which then allows them to monitor the patient 24/7.
Suren Govender trialled 30 tablets with Steady Care whilst he was working at a large hospital and was so convinced by it as a healthcare product that he joined the team in 2021.
I'm a lifelong technologist, so I look for of course, the bells and whistles when it comes to tech. And yet this didn't need any of the bells and whistles to be an effective enabler for access to healthcare. I also enjoyed the fact that there was a big emphasis played on data, both data collection as well as how we use that data to improve the experience overall of healthcare workers and the patients themselves. But mostly I like the design. It was intuitive. There was a lot of opportunity to customize and to make it meaningful as an experience again. And I suppose probably the biggest trait, but most important, was the synergies that the three of us have been able to establish and co-create. That's been probably the most exciting part of the journey.
Zain says the SteadyCare platform is currently being trialled in 3 hospitals in 2 provinces, with the goal to reach public hospitals in the future.
In the startup landscape, it's important to know that there's a lot of different startup companies working, but together as a digital ecosystem, we can definitely make an impact in terms of transforming the healthcare to be more accessible, more affordable, and more impactful in terms of the way it's delivered to the citizens of South Africa.